I myself have held the hand of dying patients who are crying out for their family that they can't see. I've taken care of coworkers as they fight for their lives on a ventilator, and knowing that they got sick because of the hospital or their government hasn't protected them. Do you know that I have not been tested yet, and I have been on the front lines in the ICU since February?
You're kidding me.
No.
For months, frontline medical workers like Mary Turner have been telling anyone who would listen about the realities that they've faced in hospitals during the 8 months of this pandemic. But those with the power to do something have not listened. Doctors and nurses have prioritized our care through this crisis, and it's time we prioritize theirs. Joining me now is Mary Turner. She's a nurse in the COVID-19 ICU unit at North Memorial Hospital in Robbinsdale, Minnesota. Mary, thank you for being with us. More importantly, thank you for what you have done for your patients. It is people like you across this country who have kept us healthy and kept us alive. I have to ask you about you. You broke down while talking to Joe Biden. Joe Biden broke down listening to you. And we hear this story all the time, what the stress must be of frontline workers and nurses who are facing treatment and coronavirus and death all the time. What does it feel like to be you right now?
You know, when I'm on the job, as all nurses, we have to be professional at all times. The work that we're doing to try to save as many lives as possible is what we're called to do. But it takes its toll in the sense that if we're holding the hand of a dying person, we don't have time to grieve. If we are frustrated and angry because we're running out of, we don't have enough personal protective equipment and we're not feeling safe. If we're frustrated because we're short-staffed and now we're getting into a situation where we're going to have to do crisis staffing, which means taking more patients than is safe for us to take. All of these frustration, anger, compassion for our patients, et cetera, all of this has to stay bottled up when we're at the workplace, because it is imperative that we stay professional at all times, and we do. We need to stay strong. But what happens, and what happened to me that day, is that when you're away from the workplace, what happened to me, I think, is that I finally felt like I had somebody that I could say all my concerns to, and then I felt like President-elect Biden was the person who could do something about it, and that he was really listening. And it caused an epiphany for me in the sense that I realized that all this emotion that I portray on the media, because it's it happens. And then what's happening is all of those emotions that I can't express at work come out when I am speaking to the media. And it was, like I said, an epiphany for me to realize what was going on with myself. And if through my emotion I can get across to people how desperately we need to take this pandemic seriously, then that's just a higher power's will. I don't know. That's just how what's coming out of me is my desperation to get people to take this seriously.
Are you hopeful?
I am now. Do I think that we have waited far too long our National Nurses United has been advocating, and I certainly have been trying to do my share about enacting the Defense Production Act. There is no reason why we don't have enough PPE for everybody. I got an email just recently from Australia, where they were kind of speaking in a condolence kind of terms, because they said, we don't have a problem here because we have a new norm. Everyone just wears a mask and we're able to go along as business as usual. Now, wouldn't that just be wonderful? That would be wonderful if our country could be doing the same thing. But we can't do it because we don't have enough of the PPE produced so that everyone can have some. Certainly all hospitals should be wall-to-wall covering as far as everyone wearing personal protective equipment. And we should be able to use the optimal standards. My N95 that I'm still wearing 2 shifts, that's nothing to some of the hospitals that I've heard where the nurses are still wearing them 8 to 10 shifts. That is not safe. That is not optimal protection. And how can we even... It's the wrong reason
to get sick.
And it's the wrong reason to get sick because we're not properly protected. And now I am having, as far as I need to talk about what our staffing situation is going to look like. Just my hospital alone, we have this past week like 60 FTEs, full-time equivalent of nurses, out for different COVID-related issues, whether they be quarantined because of children or they've had it themselves or but out. And this is happening all over the nation. These kind of shortages where there are not, many healthcare workers are forced to stay at home. And we're doing this right as we're heading into a situation where we're having to go into the surge model. What that means for us in Minnesota, they've always toted like this the past spring, something the hospitals were supposed to do was to be able to come up with emergency beds that could be opened up within 72 hours. And in this state, that's about 400 beds. Well, they are now, at least at our hospital, proceeding to do that. The problem is we might not have the staff to man those extra beds, but we're going to have to, and that means
managing this.
Right. But
Mary
like
Turner,
in New York
I can't
last
tell
spring.
you. Go ahead. Yeah.
I was just going to point out this past spring when New York City was able to draw on nurses from all over the country. That was a wonderful thing.
Can't do that now.
We won't have, nope, we won't. They can say that agency nurses are coming in all they want, but they're not. They're not, because they all are needed wherever, in whatever state they live in.
You are the cavalry, but there's only so much cavalry. Mary Turner, thank you for everything that you are doing, and as a representative of all of these nurses who have kept our loved ones safe or comforted over these last 8 months, just know that you are the heroes. And as Joe Biden has said, help is coming. Mary Turner is a nurse at the COVID-19 unit at the North Memorial Hospital in Robbinsdale, Minnesota. I think the things she says today, she says on behalf of all nurses. We thank you for your service.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.